Hi guys, Brian Whaley again. I'm gonna do another stem cell case. This is a different one. It's fun today because we have three different regenerative procedures that are really exciting for me to do. Actually, we're gonna do a facial skin resurfacing, which is basically using a product called exosomes, the juice of the stem cells, and we get those frozen and we liquefy them. And while I'm waiting for that to thaw, I go around the face to where the defects are. In this case, coming up, a lot of periorbital creping, where you see the lids become sort of wrinkled over the crow's feet and the lids kind of crisscross and that wrinkling. And a lot of that's a volume issue, but when you treat it with the exosomes and you see the resurfacing effect, it's almost as good, if not better. Around the eyes, we use a very, very, very fine micro needle, and we basically rough up the skin, we protect the eye, and we numb the area. And then on this case too, there's a lot of deep etching, smiling that makes the line that stays even when you're not smiling, those kind of things. We call that etching. And so I'm gonna rough up those etches a little deeper, and then the other eye, kind of the same. So we go shallow, we go a little deeper, we go very deep, and then when those are all sort of raw and porous, we apply a layer of the exosome, and then we needle that in. And then when that's done, I take the smallest little Botox needles that I can get, and I actually just under the surface of the skin, always protecting the eye, like little tiny blebs under the skin. They make tiny little bumps, and that will take about a day or two to heal up. And the first day you just leave it on, and all you got to do is put a little bit of Vaseline overnight. You only do that for about 2 days, and then you just let it go. And all that resurfacing occurs over the next 10 to, well, it goes on for weeks actually, but you really notice about 10 to 14 days. And all that will heal back over, become very, very smooth. Those etches will go away. If it was pock marks, if it was scars, those would level off. It just almost erase them. It's not a one and done with the bigger scars and the deeper things. It's about as good as you can get. And if you do that a couple times, sometimes you can actually get that to be like you never had a scar there. And we can get rid of the acne too with the same process. So don't wait till things scar. Get in here, because I know if you've been through 5, 6, 10, 7 rounds of antibiotic and you just want to you're over that, come and do stem cells, because I've never seen anything work better on acne and adult acne too. Look forward to meeting you guys. If you have any questions, you can always call me here. And if you can't find me here, they can find me somewhere. And I'll see you then.